Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Welcome to the Deep Dive, where we plunge headfirst into a stack of fascinating sources to bring you the most important nuggets of knowledge. Today, we're tackling a question that's, well, it's probably crossed your mind after a late-night snack. Does eating cheese really give you nightmares? It's this age-old folk belief, right? You even see it in those classic Dream of the Rarebit Fiend cartoons by Winsor McCay from way back. Characters literally blaming their crazy dreams on, eating a cheese dish.
Yeah, it's such a classic piece of folklore, isn't it? For decades, it's just been this fun, quirky idea, maybe a convenient excuse for a bad night's sleep. But this is where it gets really interesting now.
Absolutely, because this deep dive, it isn't just about folklore anymore, not at all. We're actually looking at recent scientific findings, and they seem to support some of these long-held beliefs. It's quite surprising. We've unpacked a pretty compelling health news article and also a detailed scientific paper, and they shed some really new light on this whole connection between what you eat and, well, what you dream about.
So our mission today, basically, is to figure out how diet and maybe especially specific food sensitivities might actually be impacting your sleep.
Right.
And maybe even the content of your dreams themselves. Think of it as a shortcut, getting you well informed on what's turning out to be a surprisingly robust area of research.
Yeah, robust is the word. And just so everyone's clear, we'll make sure to spell out any tricky scientific terms like gastrointestinal, we'll say the whole thing, and post-traumatic stress disorder. No acronyms today.
Good plan. Clarity is key here.
Okay, so let's dive into the core of this research then. What exactly were these scientists trying to figure out? Was it just, I ate cheese, I had a bad dream, or were they looking for something, I don't know, deeper, a mechanism?
Precisely, yeah. The core question was, do specific foods influence dreams? Like, directly? Or is it through physical symptoms, the physiological stuff? Or maybe just by messing with your sleep quality overall? They wanted to understand the how. So the researchers, they gathered data from quite a few people, over 1,000 university students, actually.
Yeah.
It was all done through a pretty comprehensive online survey. And they used, standard methods, established questionnaires to measure things like overall sleep quality, how severe any nightmares were, and of course, detailed dietary habits.
Wow, over 1,000 participants. That's a decent sample size. Gives the findings a bit more, more wheat.
Definitely.
And I noticed something interesting you mentioned about gender differences in the notes. The study found women were more likely to remember dreams and also report poorer sleep and nightmares and even more food intolerances.
That's right. They did find those differences. And crucially, the researchers accounted for these differences in their analysis. They controlled for gender.
Which is really important for, making sure the conclusions are solid.
Exactly. Controlling for those variables is, well, it's just good science. It gives us more accurate insights. So, okay, on to the key discoveries. It's quite interesting how our perceptions, what we think happens, sometimes it lines up with the data and sometimes it doesn't.
Right. Okay, let's get to the heart of it then. Did this study confirm the cheesy nightmare thing? What did they actually find?
Well, it's not quite as simple as just pointing the finger at the cheese block itself. The study found that while, a lot of participants believe certain foods affected their dreams, desserts, sweets were blamed by about 30% and dairy by 21% for making dreams more vivid or disturbing.
Okay, so people do think that.
They do, but here's the twist. Those numbers were actually lower than in a similar study from about 11 years earlier.
Huh. That is a surprising shift, isn't it, you'd think, with all the talk? Why would fewer people perceive that connection now?
It's a really good question. And the researchers, they speculate a bit. Maybe it's because there's more public awareness now about food sensitivities.
So people are maybe already avoiding the stuff that bothers them.
Could be. If you're more aware and you avoid foods that cause you issues, maybe you just experience fewer of those food-related dream disturbances to begin with. They also mentioned other factors, things like the COVID-19 pandemic, maybe more social media use. These could also influence awareness or just how people report things.
That makes sense. A lot could have changed in 11 years. Okay, so people perceived sweets, spicy foods, dairy as the culprits for bad dreams or bad sleep. And on the flip side, they linked things like fruits, herbal tea, vegetables to better sleep. That sounds about right.
Yeah, that matches general healthy eating advice.
But the real scientific link, the study called Robust, that was much more specific, wasn't it?
It absolutely was. And this is where Dr. Tord Nielsen, he's from University of Montreal, the lead author, this is where he made a really powerful statement. He said, and I'm quoting here, "Nightmare severity is robustly associated with lactose intolerance and other food allergies."
Wow. Robustly associated. That's strong language in science, right?
It is. It signals a pretty confident finding, moving way beyond just perception or anecdote.
So, okay, there's solid evidence, but how does that link actually work? Is it something in the dairy itself messing with the brain or something else?
Yeah, great question. It seems it's not the dairy itself directly causing the nightmare content, like some kind of chemical trigger. It's more about the physical discomfort it causes if you happen to be intolerant.
Okay.
The study found a strong link between lactose intolerance and nightmares, but it was mediated by gastrointestinal symptoms. That means the discomfort, gas, bloating, stomach pain during the night that you get from eating dairy when you're lactose intolerant. That seems to be the direct link. It affects your sleep quality, sure, but it also seems to directly influence your dreams, making nightmares more likely or more severe.
Right, so that's the food distress hypothesis they talk about. It's not the food, it's the body's uncomfortable reaction to the food.
Exactly. The discomfort seems to be the key player disrupting things.
That's a really important distinction, I think, because it shifts the focus. It's not just don't eat cheese, it's listen to your body's reaction. Does that mean, theoretically, any kind of physical discomfort during sleep could potentially trigger bad dreams? Like if you have indigestion from something else entirely?
That's a fascinating thought, and it definitely points towards the broader implications. It suggests our physical state during sleep is really intertwined with our dream experience. And the research also found something else interesting here. Anxiety and depression symptoms also played a role. They partially explain this link, this mediation.
So mental health is tied in too.
It seems so. While overall poor sleep quality also partially mediated the link between lactose intolerance and nightmares, it wasn't only through those gut symptoms. It suggests a more complex picture, this interplay between the gut distress, overall sleep disruption, and maybe underlying mental health factors.
Okay, so it's not just about lactose intolerance. Even though that link seems particularly strong through the gut symptoms, did they find connections with other food sensitivities as well?
Yes, definitely. They found that food allergies, more generally, and also gluten intolerance, were associated with this idea of food-dependent dreaming. And interestingly, food allergies, just on their own, independently predicted nightmare severity. So while lactose intolerance had that very clear pathway through the gastrointestinal stuff, other sensitivities are absolutely part of the picture too. They can impact your dreamscape.
This really builds a strong case for paying close attention to how different foods make you feel, doesn't it?
It really does. Self-awareness seems key.
What about the other side of the coin? Healthier eating habits. Did the study show any positive effects on dreams?
Absolutely. They found that healthier eating patterns, things like eating less in the evening, choosing more nutritious foods that align with your body's actual needs, these were linked to higher dream recall.
Higher recall.
Right.
So maybe more vivid dreams or just remembering them better. Does it suggest better dreams?
The study linked it specifically to recall. Whether that means more positive dreams wasn't explicitly stated in that finding, but it suggests a connection between healthier eating and, perhaps, a more active or accessible dream life.
Interesting. And the flip side, I assume unhealthy habits had the opposite effect.
Exactly right. On the other side, things there called unhealthy eating indicators, like how severe your gastrointestinal symptoms are after eating, maybe ignoring your body's hunger and fullness cues, or that tendency to eat a lot in the evening. These things predicted more nightmares and also a more negative emotional tone in the dreams people did recall.
So it's not just what you eat, but when you eat, it really seems to matter quite a bit.
That's a huge takeaway.
Yeah.
They looked at both eating generally late at night, they call that night eating, and also eating specifically close to bedtime, termed evening eating. Both were significantly associated with poor sleep quality overall, a more negative emotional field of dreams, and higher scores on the Nightmare Severity Index.
Wow. This has some really practical implications then. For you, listening right now, if your food choices, and even when you eat, can genuinely influence your dreams, well then making some simple dietary tweaks could be a real option, like a non-drug approach to managing disturbed dreaming, especially if you suffer from nightmares. That feels pretty significant.
It really is. It potentially opens up a whole new avenue for intervention, one that doesn't immediately jump to medication. And what's really fascinating here, I think, is how neatly this research slots into our growing understanding of the gut-brain axis.
Right, that connection we hear more and more about.
Exactly. We're learning just how much our gut microbiome, the bacteria in our gut, can impact our mental health, our mood, everything. And this study sort of suggests that specific foods, maybe dairy or sweets for some people, might aggravate symptoms related to this connection, essentially acting on the brain through the gut triggered by that food distress.
And does this connect to conditions we already know are linked to that gut-brain pathway?
Yes, absolutely. Think about something like irritable bowel syndrome, IBS. We know that in conditions like IBS, there can be issues with serotonergic modulation. That's basically how our body uses the chemical serotonin, which is crucial for gut function and mood and sleep. If that system is dysregulated, impacting the gut-brain axis, it might help explain this link between diet, gut issues, and nightmares, because serotonin signaling is also involved in regulating dream emotions.
Okay, so if diet can impact everyday nightmares through these gut-brain links, could this research maybe even offer clues for more severe issues, like, the really frequent and distressing nightmares that are a hallmark of post-traumatic stress disorder?
That's a really important area where this might connect. There's already research looking into how diet, for example, following a Mediterranean diet, might affect post-traumatic stress disorder symptoms. And they're even looking at the gut microbes involved. So the findings from this study, highlighting the role of specific food sensitivities like lactose intolerance or allergies, it really suggests that assessing these individual sensitivities could be incredibly valuable when developing dietary approaches for managing PTSD. It points towards a more personalized nutritional strategy.
It really brings things full circle, doesn't it? It almost makes you wonder about Winsor McCay himself, the rarebit fiend cartoonist we mentioned at the start.
Right.
Could he have been onto something deeply personal? The study actually speculates about this. It mentions he explicitly blamed bizarre events occurring in their dreams and nightmares on symptoms associated with eating cheese dishes prior to sleep. Maybe he was lactose intolerant.
It's a wonderful historical echo, isn't it? Suddenly, this quirky old cartoon seems potentially autobiographical, backed by modern science. But we do need to be careful. It's really crucial we talk about the limitations of this study.
Okay, right. Important caveat time.
Yes, because while the findings are compelling, very compelling, this was a correlational study. It shows associations. It shows these things tend to happen together. But it doesn't definitively prove that the food causes the dream changes.
Got it. So we can't say eating cheese causes nightmares, full stop. It's more like for people with lactose intolerance, eating dairy is associated with more nightmares, likely due to the physical discomfort it causes.
Precisely. That's the nuance. It could be, for example, that people who sleep poorly generally make poorer dietary choices. Or maybe there's some other factor, some third thing we haven't measured that influences both diet and sleep and dreams.
So how do we get closer to proving cause and effect?
Well, you'd need more experimental studies, like a controlled trial where you actually give one group of lactose-intolerant people dairy before bed, and another group a placebo, like lactose-free dairy. And then you carefully measure their sleep and dream experiences. That would give much stronger evidence for causality.
Okay, that makes sense. And what about the people in this study? They were all university students, right?
Yes, first-year university students specifically. And that's another limitation. Relying just on that group, that demographic, it means we need to be cautious about generalizing. We need studies involving more diverse people, different ages, backgrounds, health statuses, to see if these findings hold true more broadly.
What's true for a 19-year-old might not be the same for a 50-year-old, for example.
Exactly. And there are other context things, too. The study didn't really delve deep into cultural beliefs about food and dreams, which vary a lot around the world. That could be a whole other fascinating area.
True. And just, society changes.
Right. The researchers acknowledge that things like the rise of social media, changing awareness around health, even the massive disruption of the COVID-19 pandemic, all these things might have subtly influenced how participants experienced or reported their food sensitivities, their sleep, or their dreams over the past decade. It's a complex web.
Okay. Well, despite the limitations, this has been a truly fascinating deep dive. It really takes something that felt like, a quirky old wives' tale, almost a joke sometimes, and it grounds it in some pretty serious scientific inquiry. It just makes you realize how interconnected everything in our body is: gut, brain, sleep, dreams.
It absolutely does. I think the core takeaway here is pretty clear. Our diet, And particularly our individual sensitivities to certain foods can indeed have a real measurable impact. An impact on our sleep quality, yes, but also on the very nature of our dreams. And that link between lactose intolerance and nightmares mediated by those uncomfortable gastrointestinal symptoms, that seems like a key piece of the puzzle. It gives real scientific weight to some of those long-held beliefs.
So thinking about all this, what really stands out to you, our listener, from these findings? I know I'm definitely going to be thinking a bit more carefully about my late-night snack choices now, especially if dairy is involved.
And that's kind of the point, isn't it? It brings awareness. Many of us have probably had that experience, that vague feeling of unease or disrupted sleep after eating something late. And this research provides a potential scientific why behind it. But maybe it goes beyond just avoiding bad stuff. Here's a final thought to ponder. Given this powerful gut-brain connection, this link between what we eat and how we feel, physically and mentally, could understanding and maybe even intentionally shaping our diet become a tool? A tool not just for better physical health, but maybe an underestimated way to manage our inner world, our dreamscapes. Could we move beyond just avoiding nightmares, perhaps towards even cultivating more positive or insightful dream experiences through diet? It's certainly something to think about.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.